Magandang adlaw everyone! Welcome to CORRdapya TV. If you're new to my channel, my name is Cor and I'm your basic nurse from Southeast England. Before starting our discussion vlog for today, let me take this moment to extend my warmest gratitude to my channel supporters and viewers. We are now officially 2,000 subscribers. So keep supporting me guys to help me grow this channel. As my way of saying thank you to all of you, I will be doing the most requested topic on my YouTube channel. I am going to help you ace your interview in applying for a nursing role in a care home. So I will be sharing general questions and I will give you advice on how to answer them. My aim is to help you to appear as natural as possible as opposed to being scripted or monotonous. I will provide hints on what the employers want to hear from you during the interview. So let's start. I will be dividing this discussion into two parts. First, questions which are all about the applicant, focusing on yourself, experience, and education to evaluate your values such as being caring and having the sense of responsibility. Second part would be role-specific questions to gauge your critical thinking and knowledge. So, for part 1, the CV overview. These are the questions focusing on your work history, educational attainment, and values as mentioned. So, these are the common questions employers would ask you. I will be sharing to you 5. Number 1, can you please provide us an overview of your CV? So, how would you answer this question? So, you will be sharing briefly your job roles and responsibilities. And you may want to add any voluntary work taken even outside healthcare, as this will create an impression that you are sharing yourself to the community, which is a plus. There is no harm to share your work gaps and provide a short explanation why you have these work gaps. Most importantly, highlight your skills and learnings which you believe will impact in earning the role you applied for. The second common question that you will encounter is, what made you interested to work in a care home and why not NHS? So firstly, you should have researched the difference between private healthcare sector versus NHS. Understand the services offered so that you would know what environment you are heading to. It is also good if you look into the company, acquaint yourself with their mission and vision so that this will provide you insights about the company. Evolve your answer around the company's goal. So apart from those things, you can share your motivation why you wanted the role. It is also a good point if you express your desire for career development, as this would mean that you are committed to share more of yourself to the company. Third question, tell us about the time when you have supported someone. It can be your patients, relatives, or colleagues through the end-of-life care. So my advice on how you would answer this question is, you can talk about assisting a sick relative who can't afford to go to hospital, hence nurse at home, or maybe helping a dying patient to feel comfortable until their last breath by ensuring gentle personal care and by providing emotional support. Real experiences are the best answers. Yet, if you think you have nothing to share, respond honestly and then you can take references from any of your life experiences when you felt that you have contributed to someone's well-being. Alright? Number 4. In order to lead a team effectively, what are the qualities that a nurse must possess? So among these qualities are demonstrates honesty and integrity, excellent communication skill, good decision making, and time management of course, encourages autonomy to make team members self-motivated and efficient, has empathy, and lastly, innovative. Innovative thinking means thinking outside the box, especially when dealing with difficult situations. So for my last sample question under CV overview is, can you share a time when you work under pressure and how did you overcome this situation? So this could mean managing a unit despite having short staff, or handling too many critical patients at the same time, or in my case, dealing with multiple deaths in one shift. So you can focus your answer on what was your role during those time or during those challenging moments and what have you contributed to the team and how you felt about it. Now let's go to the second part of this discussion, role-specific questions. So these are simple nursing-related questions, perhaps some situational questions to gauge not only your knowledge, but more on your capability to manage situations in a nursing home. So sample question number 1. During your shift, there are residents showing signs and symptoms of COVID-19. What are the measures you will take to support them clinically, and what are the actions to take to prevent the spread of the virus? So how would you answer this? For example, first thing first, you have to protect yourself by wearing appropriate PPE, and then check the residents' vital signs. Do a rapid test for COVID-19 infection if available in the home. Keep the residents isolated and always keep them hydrated and comfortable. You have to notify the GP and their families, and you have to inform the staff and the management to ensure that infection protocol is being followed. Number 2, common question. What are the interventions for hypoglycemia or hyperglycemia? So this question is basically self-explanatory. You know how to answer this. But my advice is for you to read about diabetes management here in the UK, especially in a care home setting. Third question. What would you do if one of your residents mentioned that they were hit by a carer and was verbally abused by them, but they asked you not to tell anyone about it? What would you do? Although we have to respect residents' wishes, we cannot promise to keep serious matters like this, as this is a safeguarding issue that needs to be resolved. So my advice for you is read about CARE Act and safeguarding. Read about different types of abuse, as this will give you an idea how to deal with situations like this. The fourth common question would be, what would you do if someone inquired about the resident's health history outside the clinical setting? I know you obviously know the answer, but it is an advantage if you have knowledge about GDPR or General Data Protection Regulation. Take note, data privacy is a big deal here in the UK. So for my last sample question, how would you handle your shift if you are short of 2 members of staff? So go to the basics. You have to learn how to prioritize. The staff to resident ratio depends totally on the level of dependency of the residents. So identify which unit needs more help. Skill mixing is crucial in this kind of situation. This is also when working beyond what is expected of you sets in. So you have to lend support to your staff to ease the workload. You would also encounter questions relating to pressure sore management and any situations requiring prioritization. Remember your ABCs: airway, breathing, and circulation. Keep in mind that safety first before addressing the ABCs, meaning keeping a hazard-free environment. So these are my 10 tips for you to pass your interview. The first one is prepare your answers. Outlining possible answers will ease your nerves, of course. And by watching this discussion vlog, this will serve as a guide for you on how you will attack these questions. Number 2, be on time. Although most of the interviews now are being done online, you still need to be on time. So if your scheduled interview is at 10 o'clock, you have to be ready at 9:30. You have to check your internet connection and you have to check your audio as well. My third tip is appear smart. So even though it's an online interview, you still have to look presentable to the interviewer. Fourth tip, have your CV with you. So having a copy of your CV in front of you will help you explain any points easier to the interviewer. So you don't really need to panic when you don't remember some things about your work history. Tip number 5, stay focused and relevant. So keep your responses on focus and discuss only things which are relevant to the role you're applying for. Remember, talking too little is as bad as talking too much. Number 6, be confident when you answer your questions. Maintain eye contact and be mindful with your gesture and voice tone. Number 7, avoid ranting about your previous workplace, employer, or colleagues. This will create a negative impression against you. Number 8, do not focus on money. Sure, we all want to be earning as much as possible, but don't make it as your primary focus. Get a feel for the culture, potential for growth, and other opportunities within the company. Remember, Ensuring the company is right for you is just as important as the company knowing that you are right fit for them. Alright? Number 9, thanking the interviewer. So you can send them an email after the interview because this will show that you are very much interested to the role. Lastly, pray, stay positive, and be patient. So before we wrap up this vlog, write this down. Familiarize yourself about NMC Code, CARE Act, Mental Capacity Act, Safeguarding and DOLS or Deprivation of Liberty Safeguards. You will never go wrong with these readings, I promise you. You don't really need to memorize them, but understand them instead. Thank you everyone for staying and listening with me today. Hopefully you find this vlog helpful. If you have not subscribed yet, please do and click the notification bell to keep you updated for my future vlogs. May you achieve your nursing career goals in the future. I'll see you soon guys. Thank you for watching. Bye-bye!